Hi everyone and welcome back to my channel. My name is Morgan and I'm a clinical mental health counseling student. I've had a ton of assignments that involve analyzing a case study, and before starting my master's, I had absolutely no experience whatsoever in dealing with case studies. So today, I'm going to break it down to a beginner's level and explain some lifestyle factors that are making a client's depression worse. Case studies involve a lot of little details that you can easily miss, but once you get them, there's so many opportunities for things to write about. So if you want to be able to pick up on all the little hints in your assignment instructions, keep watching. Depression is such a broad category, and it can be exacerbated by a lot of factors and circumstances. Here's some things that might be alluded to in a case study. Social isolation. A client might withdraw from social interactions, or they could report feeling disconnected. Feelings of loneliness greatly contribute to feelings of sadness, and this will make the symptoms of depression worse. Negative thought patterns. For this one, you'll have to have a good understanding of the cognitive triad. This could be self-criticism, rumination, or hopelessness. Clients might also express feelings of worthlessness tied to their career or their relationships. Negative thinking patterns create a vicious cycle, and it's hard to get out of it once it spirals. Unhealthy habits. This could be poor diet, lack of exercise, inadequate sleep, and substance abuse. These lifestyle factors can affect mood regulation, energy levels, and overall well-being. Significant life events. This could be loss of a loved one, financial difficulties, relationship problems, or work-related stress, among many more potential life circumstances. A random outside event can intensify a depressive episode, or it can make it harder to cope with existing symptoms. Chronic health conditions. Be on the lookout for chronic pain, autoimmune disorders, neurological conditions, or any chronic health condition because this can exacerbate depression. Clients who have to deal with limitations can get really discouraged. They may report hopelessness or despair. Substance abuse. This includes alcohol, marijuana, illegal drugs, or prescription medications. Clients sometimes use this as a crutch, and in the long run, it makes things worse. This can easily interfere with treatment effectiveness. Substance abuse can impair judgment and exacerbate mood swings. And a lot of clients will experience increased feelings of guilt and shame. Unresolved trauma. Past trauma, such as childhood abuse or neglect, can contribute to the development or worsening of depression. If it's still unresolved, there can be feelings of helplessness, shame, and emotional dysregulation that the client's not really sure where it's coming from. Unhealthy relationships. Being in a toxic or abusive relationship can undermine mental well-being. Be on the lookout for a lot of conflict or more negative interactions than positive interactions. Clients in these types of relationships can feel worthless or have lower self-esteem. Unemployment or underemployment. Job loss is a huge factor, but also dissatisfaction with work is important to pay attention to. Clients may deal with financial stress, loss of purpose, or feelings of failure. If a client feels inadequate in their work life, they could have feelings of hopelessness or despair. Limited access to treatment. When thinking over your assignment, be aware of multicultural factors. A lot of cultural factors can impact somebody's ability to access treatment. This could be an issue of socioeconomic status or stigma. Geographic location also greatly limits people. Identifying and addressing these factors are going to improve your client's overall well-being. So think about how you can tie these issues into specific assessments you could administer, behavioral changes that you could suggest, or long-term goals that you could collaboratively set with the client. Remember to focus on their social support and the people that are already in their lives. Leaning into their strengths may seem counterintuitive when you're trying to fix a problem, but that's the best way to get them the help they need. Really take your time to think about every aspect of this person's life, their family, their friends, their hobbies, their work, where they live, their religious affiliation. All of these are going to provide you opportunity to help this person find deeper purpose and meaning in life. If you found this video helpful, please do me a big favor and hit the like button. It really goes a long way in helping me in the algorithm. And as always, thanks for coming to my channel.